I am Dr. Anita Tripathi, Senior Consultant Pediatrician working in Medcover Hospital for Women and Child, Visakhapatnam. Today I will be speaking in brief regarding rabies vaccination, what should be done urgently, because we see so many cases of dog bites and rabies. And frankly speaking, rabies is such a disease that is 100% preventable, but it is 100% fatal. If somebody gets rabies, you cannot escape from the disease. Death is imminent. So, it is all in our hands. Rabies is a zoonotic disease. That is, it is transmitted from animals to human beings. Not through blood, it is transmitted through bites, through licks, and through one animal to the other also. It's not only dogs. Of course, more than 90%, 99% cases of rabies is transmitted through dog bite. But other mammalian bites also, rodents, monkeys, rabbits, hares, wolves, rats, and another thing is bats. Even if you are exposed going to caves where there are bats inside, always it is better to get a pre-exposure prophylaxis. And it spreads by the bite or even by the lick of an animal. Especially I am speaking about dogs. And category 1 bite, what you should do. Supposing you are okay, you are healthy, your skin is intact. A dog comes and licks. Rabies vaccine is not required. It is a category 1 bite. But if the dog licks, even if there is no bite, but you have a wound over it, it is an abrasion, it is a very superficial cut without any blood, without any exposure, then it is called category 2 bite. And for such category 2 bites, what should we do? Any lick, any bite, first and foremost, wash the part. Wash the area completely thoroughly with soap water. 10-15 minutes. That will reduce 80% of the virus overload. And after washing, what should you do? If supposing povidone or something is available, you can apply over it. Then meet the doctor or the nearest hospital. And supposing the bite is a bit deep, the dog has caught hold of you, even if there is no wound or if there is a wound or a deep cut, and if it is a deep bite, a portion of the skin is removed, then it is called category 3 bite. And for such bites, immediately first and foremost, whatever it is, immediately wash the area. After washing, you go to the hospital. You will be given a pre-exposure prophylaxis of the rabies vaccine. The vaccine is better to be given within 0 to 24 hours, as early as possible after the bite or the lick. So, the vaccine is given on 0 day, 0, 3, 7, 14 and 28 days of the dog bite. And when to give rabies immunoglobulin? Nowadays rabies immunoglobulin are given. This is given for category 3 bites. So, apart from giving this intramuscular vaccine on these days, you have to go for immunoglobulin. So, only vaccine will not protect you. So, immunoglobulin should be given at the site. Supposing the bite is over the face or the neck or over the leg or the thigh, it should be given on that area. Maximum inoculation, it should be injected into and around that area, so that will take care of the infection. Antibodies will develop. Nowadays, recently they say monoclonal antibodies are also available. That can also be given instead of the rabies immunoglobulin. And What will you do supposing you have been bitten by a pet dog, by a puppy who is recently born? It is a 2-3 days puppy. You have to give the vaccine because usually the pets are given vaccine at around 6 to 8 weeks, repeated again at 16 weeks, and again it is yearly. But sometimes there is a window period. So always never hesitate to clean the wound area, take the vaccine and the immunoglobulin or the antibody if it is category 3 bite. Nowadays all the vaccines are given at all government health centers here in Visakhapatnam, in KGH, and all the PHCs, district health centers. Even the immunoglobulins are also given free of cost. Even though they are costly, it is given. So you have to go to the local health centers. Never ask for stitching the wound. It is a deep cut. Never stitch the wound. It should be kept open. And what should you do at home? Your pet dog, or you have visited somebody's home, their pet dog. They say, we have given our pet all the vaccines, or you say, my pet is vaccinated. Still go for the vaccine. Go for the, if it is a category 2, you have to go for 0, 3 and 7 days. And pet dog, you can always follow and observe the dog for 10 days. If the dog is alive, if the dog is okay, not virulent, then you can stop the vaccine. But if it is a category 3, go for the immunoglobulin. And if the dog cannot be traced, then you have to give the full course. Supposing you have taken the vaccine about 1 month back, you have finished your course. So are you protected? After 2-3 months, again another dog has bitten you. What will you do? So such cases, if you are given a vaccine, the full course you have given, it will protect you up to 3 months. But later, maybe you have to take the vaccine. So what are the symptoms of rabies? Sometimes we know many, one I think a hockey player, he expired of rabies last year. It was a nationwide call. After that, everybody became, he tried to protect a small puppy from the canal on the drain. But he had a wound, he had a cut. He didn't take any vaccine, small puppy, okay, he just washed, but he succumbed to rabies. So we should never neglect, it is in our hands. If we take it, we can protect ourselves totally. There are 18 to 20,000 deaths in India due to rabies. So what happens? It is not transmitted through blood. It is a neurotrophic, it is a virus. It is transmitted through the nerves. So it takes maybe 1 day, it may be 1 month, and up to 5 years also. The virus, once bitten, it can remain, but generally it is 1 to 3 months. So once you get the rabies, you will feel dizzy, altered sensorium, you will get hydrophobia, fear to drink water, you will be having aerophobia. Supposing somebody is fanning, you cannot tolerate that fan, and within 1 to 2 weeks, the patient succumbs if gets rabies. So please vaccinate yourself. Please be aware of the vaccine. All government health centers, they give the vaccine free of cost. Take care, protect yourself, and you can prevent. Thank you.